grandfather was very much a social justice advocate, and when I was younger, he had a lot of meetings with Indonesians from Chinese descent, and they were sort of fighting the injustices that were happening by the Indonesian government. So I sort of raised in this environment of always doing something. And then I think the leap to social justice for just people in general, and in America, underserved populations, is really not a big leap, and that's really what I was interested in. Family really influences everything that we do, including what kind of healthcare decisions we make. And so I think seeing my grandfather putting the interest of other people before his own, and wanting to change a situation and not wanting to just accept it for what it was a really big message for me. And so that has really stuck with me always, wanting to make that difference and not just sort of accept the status quo and think that that's okay, especially if people weren't happy or they weren't getting the care. So I think having a family member, those are our roots. And it's a very sort of similar parallel to disparities, right? So if, as a family member, we are told by our grandmother that, well, I don't trust the doctor, I'm just going to pretend that I agree with everything that he says, but I'm going to go home and do my own thing, then that's a message that gets internalized. So I think the social justice issue, really hearing that from my grandfather, sort of stuck with me, and then it sort of permeated everything that I did. Was like, don't accept the status quo, which means don't accept that disparities exist. We can do something about it. We can change it. This is not okay.